During the COVID-19 pandemic, South Dakota has remained perhaps the freest state in the Union. South Dakota's Republican Governor, Kristi Noem, only issued one executive order throughout the entire COVID-19 pandemic, and it merely offered suggestions using the word should, as in local municipalities should implement the recommendations of the CDC, retail businesses should suspend or modify business practices according to the CDC, employers should implement the CDC recommended hygiene practices, every South Dakotan should review and practice the CDC hygiene practices. Nowhere in Governor Noem's executive order is there a mandate that says a person or business must do something or act a certain way under penalty of law. This is not to say people in South Dakota are not practicing hygiene, distancing, or face mask usage. It's just that the governor has chosen not to mandate those personal activities under threat of fine or penalty. South Dakotans have remained free to make their own decisions on their lives and evaluate and accept the risk options without a nanny state dictating what they must and must not do. Speaking at Hillsdale College, Governor Noem spoke about liberty and the pandemic.
That in the last 6 months, it has amazed me to watch fear control people. That this pandemic really used emotion and fear to manipulate people in ways that we've never seen before. And what bothered me early on was recognizing the fact that when you have a leader overstep their authority in a time of crisis, that's when you lose your country.
Governor Noem admits her state took a unique path in their response to the pandemic.
Now, my approach to this virus was to provide South Dakotans with all of the information that I had available to me and to then allow them to exercise their freedom to make the best decisions for themselves and for their families. We took a unique path. We did not lock people up. We did not close any businesses in the state of South Dakota. Not once did we issue a shelter in place. I didn't even define what an essential business was, because I don't believe that I have the authority to tell you your business isn't essential.
The data for a free South Dakota compares similarly with Maine, a state which has a slightly larger population, but at least as much rural real estate. However, Mainers found themselves trying to navigate an oppressive nanny state under Democrat Governor Janet Big Sister Mills, who has issued multiple executive orders throughout the pandemic attempting to micromanage the life and business activity of all Mainers, mandating business closures, social distancing, and face mask usage, which now must be adhered to under penalty of law. As of January 15, 2021, South Dakota had logged around 81 COVID deaths per 100,000 of its population, or about 9 times its deaths per 100,000 of the previous June. Meanwhile, Maine, even with all the mandatory requirements of social distancing and face mask usage, still had a 5 times increase in its deaths per 100,000 over the same time period. According to data compiled at the U.S. CDC, respiratory diseases are the least cause of death in South Dakota. Like most other states, circulatory disease tops the list of causes of death in South Dakota, followed by cancer, Alzheimer's disease, and in 4th place, respiratory diseases, a group to which COVID-19 belongs. While the COVID deaths in South Dakota briefly peaked to a 7-day rolling average of 20 to 25 deaths per day around the 1st of December, those numbers have been dropping continuously since then and were hovering around 10 per day as of mid-January 2021. COVID-19 hospitalizations also peaked in South Dakota to around 600, but have since dropped to the low 200s. As of January 15th, there were 227 people hospitalized for COVID-19 in South Dakota, which isn't that far off from Maine, who had 193 hospitalized for COVID at that time. South Dakota is only testing around 10,000 people per week, but has a relatively high positive case rate of between 30 to 40%. According to Johns Hopkins University, who is tracking the COVID data in the states, a high positive case rate suggests that a community may largely be testing the sickest patients. For example, only testing those who come to the hospital with symptoms, like is normally done for seasonal flu. This seems to be the situation as reflected in the COVID Tracking Project's graph analysis for South Dakota, which shows daily tests decreasing concurrently with those who are actually hospitalized for COVID-19. Maine, on the other hand, is testing a massive 60,000 people per week and has a much lower 6 to 8% positive rate, which means they are testing mostly healthy people. Actual new COVID-19 cases in South Dakota have dropped below 500 per day in mid-January, with no mask or social distancing mandates from their governor. Meanwhile, Maine, with mask and social distancing mandates, is experiencing around 600 new cases per day, a number that is continually trending upward. South Dakota's healthcare system is in pretty good shape. As of January 15th, only 8.3% of the occupied hospital beds were for COVID-19 patients, and 38.9% of their total hospital bed inventory was empty. 22.4% of South Dakota's occupied ICU beds were for COVID-19. Maine has comparable ICU numbers, with around 20% of its occupied ICU beds being with COVID patients. Due to the increased psychological stress, Maine, with its excessive mandates, has seen a marked increase in both suicide and domestic violence homicide, as well as deaths from opioid drug overdoses. Since these deaths can be correlated to the COVID-19 response, they must, to be fair and accurate, also be added into the overall COVID-19 death results. At the end of the day, when all ancillary deaths due to the stress of mandates and lockdowns are tallied, we may find that South Dakota has ended up doing much better than Maine and the other states that tried the central planning model of authority and mandates. South Dakota, then, has set the standard for successfully merging liberty with a pandemic. These stories and more in the print edition of the Fort Fairfield Journal. For WFFJ-TV, I'm Dave DeShant.